Hello, welcome to my channel. My name is Nurse Pauline. I will be uploading my videos on Tuesdays and Thursdays, Eastern Standard Time. First of all, I must say a special thank you to all the people who have subscribed to my channel. Thanks for all your comments. The goal of my channel is to assist nursing students to be successful in their fundamentals of nursing exam. I will be presenting as many answers that will be on your fundamentals exam or your final exam, or you'll see them in your Nclex. The topic today is about delegation, RNs and LPNs. But before I get started, I need to talk to you about something first. Then I'll go right into delegation. I'd like to clarify Code Blue. Code Blue, you call for patients who do not have any respiration, do not have any pulse, and you will see this on your exam. We're talking about meds call. Who do you call the meds call for? We'll call for patients who are complaining of chest pain, patients who are having seizures, patients who are having symptoms of stroke. We will call the meds team for patients who are having abnormal vital signs, blood pressure too high or too low, heart rate too high or too low, patients who are symptomatic. We'll call the meds team for ineffective airway, patients who are having difficulty breathing, decreased level of consciousness. Pain is uncomfortable, but it can be resolved. You do not have to call the meds team for pain. If it's chest pain, that's an emergency. Okay, we'll go straight into delegation. We're talking about who should we delegate patients to the registered nurse. We will delegate patients who are admitted, patients who are discharged, patients who need critical thinking, CAREPLANS, ADPIE, admission, diagnosis, planning, intervention, and evaluation. The RN will do a new post-op patient on the floor. Please do not give it to a new nurse. The registered nurse will do blood transfusion through a number 20 IV or a central line. The registered nurse do patients who are having difficulty breathing. The registered nurse will feed patients who are having difficulty swallowing. This patient is at risk for aspiration pneumonia. We'll elevate the head of the bed when feeding this patient. The nurse, the RN, will do patients who have collaborative care. This patient is a patient who will have respiratory therapists. If they are in the hospital for quite a while, you see the infection control consult doctor coming into the bedside, because when patients are in the hospital greater than 3 days, they tend to develop NASOCOMIAL infections. We will see this patient. The dietitian will come around. Maybe the person is on a TPN. This person will need visit from a dietitian. We'll see a social worker coming around to see this patient. We'll see a physical therapy coming around to see this patient. This patient has a lot going on, and this patient will have a lot of collaborative care. The registered nurse will take care of patients who are on neutropenic precaution. This patient, WBC, is concerningly low. It's of concern. This patient will be on neutropenic precaution. Before you enter the door, make sure the sign is on the outside of the door. So everybody entering, the staff, families, friends, they will have to don their PPE and they'll have to wear a mask before entering the room. We are protecting the patients from developing any infections from the staff or family members or friends because the WBC is low. This patient is at risk to be transferred to a monitored floor or an ICU neutropenic patient, so the registered nurse takes care of this patient. The registered nurse takes care of patients who are unstable. The registered nurse takes care of patients who have abnormal labs. Maybe this patient has decreased potassium quite a few days. The staff is aware of it, and we'll have to administer potassium runs, IV. Maybe this person has low magnesium. We'll have to administer magnesium IV for this patient. Maybe we just sent some labs out on this patient trying to find out what the cardiac enzymes results are. So patients who are having abnormal labs, the registered nurse takes care of that patient. The registered nurse is responsible for TPN administered through the central lines. The registered nurse is responsible for blood transfusions. LPNs can do education, but it's up to the registered nurse to reinforce that education throughout the admission and discharge. The registered nurse reinforces discharge education, make sure the patients and family verbalizes understanding of the discharge instruction. We need compliance. We're trying to decrease early return or early readmission of patients. We need them to be compliant. They have to verbalize understanding of maybe wound care, how to do their dressings. Maybe they have to demonstrate administration of insulin injections, return, demonstration, and verbalization of understanding of administering the sub-Q insulin injection. The registered nurse updates the doctor concerning the patient. The registered nurse performs and leads in the case of a meds call. The registered nurse performs and leads in the case of a code blue. The registered nurse administers chemotherapy on an oncology floor. And that's it, guys, for the registered nurse. Now we go along and we tell you what the LPN is allowed to do in the hospital. The nurse can't do everything that the LPN can do, but the LPN is not allowed to do everything the registered nurse is doing. The LPN provides care at the bedside, administers oral medication, documents therapeutic effects and responses. The LPN takes vital signs, weights, heights of the patients and document. The LPN does injections, example your flu shots, insulin injections. Your LPN does enemas, suppository administration. Your LPN does kidney dialysis, caring for tracheostomy, suctioning. The LPNs can do tube feeding through a G tube or an NG tube. The registered nurse does a TPN, parenteral nutrition, through a central line, not the LPN. The LPN do not do central lines. The LPNs, they do dressing change. They can collect sample blood, sputum, urine samples. They do wound care. They can do oxygen treatment. The LPN, they have communication skills and they can monitor IV dressings. And that's about all the LPNs are allowed to do. I will be presenting a video following this video about what the PCTs are allowed to do. Please hit the thumbs up button, please hit your subscribe button, and please share this video. Thank you. Have a blessed day.